Good morning.
It's all yours.
Thank you very much. Good morning, everyone. I lead Google Cloud for EMEA, our healthcare and life sciences vertical. Pleasure to be with you here today. I also lead our global health equity efforts across Google Cloud. So I would just want to share a perspective with you around how we're considering the rise of consumer agency as being one of its pivotal moment in time today to really address some of the challenges that are facing healthcare today. And of course, 15 minutes is hardly enough time to give this topic justice, but hopefully give a flavor of how we're thinking about it more broadly and how we should consider it. I think it should start with the premise that everyone should have access to health technology resources and for those to be useful. And what's very important as we consider this is that we think through multiple domains, whether it's consumers, caregivers, and communities. We know that the thinking about just an individual part of this on its own is not enough to address the challenges of healthcare. We know, for example, for vaccine uptake, the role of communities is critically important. We know that the literature tells us, it depends what literature you read, of course, but most of our health outcomes are driven by social determinants of health. So in other words, our genes are important, but where we live plays an even bigger role. So access to healthy food, crime rates, access to transportation. Yet we don't really consider these factors when we are delivering health. So as we think about these 3 C's as being quite important for the rise of consumer agency, and I'll just give you some examples of how that addresses or how that plays out. One very critical challenge that most of the ecosystem of partners that we discuss, and I'm sure will be very much relevant to you, is that digital technology is tough to scale. It's broadly difficult. What might work in one country doesn't necessarily work somewhere else. And regulation certainly is a factor. But if you go back to the 3 C's, it's very important to think about the caregiver, the community context, and the consumer as a part of that. Now, huge challenges that we're facing as the decade plays out. And these are just some statistics from the WHO and Deloitte here, where they're estimating about 10 million health worker shortage by 2030. And health inequities, this is just from the US, the second point here, reach $1 trillion in the US by 2040. So in other words, if we don't tackle this, if we don't address this, the costs of the healthcare system are going to be astronomical. We know that if we deal in preventative strategies earlier, not only do you drive a better health outcome, but you're also much more cost-effective for society at large. So this is a huge, massive impending issue. And in reality, you don't really need to look out to 2030. If you try to talk to your doctor today, certainly in the public sector, you'll know that you're going to be on a waiting list. So this is playing out as we speak. So how should we think about health equity within the context of the rise of the consumer agency? Well, first of all, health is more than just health care. So most healthcare related events happen outside of a doctor's office, yet the entire funding for the system, or the vast majority for the funding of the system, is allocated towards what happens within a hospital's 4 walls or a clinician's 4 walls. So thinking about it more holistically is very important. We also need to be very aware that technology can be a great leveler and equalizer in the delivery of care, but equally, it could cause great harm. So in other words, if we have AI applications that have not been properly tested or are using poor data to train the models, you're exacerbating inequities of care. And we have a business and technology imperative. So the good news is that this is broadly very good for society, and it of course is also very broadly good for cost savings, and it thus represents also a very important business opportunity to promote health. So it's really in an ideal inflection point as we think about the delivery of healthcare. So what are the roles, and how do we need to think about that within the context of the rise of the consumer? So there are many search engines out there, many places that people go to obtain information. The data that I'm sharing with you is from Google because I work at Google, but you can imagine this being broadly for other types of platforms as well. And this is sort of some information just to sort of provide you how people are looking at information today. And there needs to be a recognition that the first place that people try and get access to information, such as, why am I feeling this way? Where's a doctor near me? How could I get more information about this condition? Will start as an online interaction. And in fact, we get hundreds of millions of people coming every day with health-related questions. The role of wearables is also increasingly playing a very big role. You'll see there the number of active Fitbit users that we have globally, and you'll also see that there's a huge amount of people who are also consenting to have very important metrics. So in this case, atrial fibrillation, which is an algorithm that we deployed in Europe, to be able to detect atrial fibrillation as screening mechanisms so that people then say, gosh, there might be something here, let me go check myself out. And that's also, I think, an important distinction of how we think about technology. We're ultimately not a healthcare company, we're a technology company. What we want to do is give tools for people to be able to improve their agency and be able to understand what they could do. Now, of course, online interactions, wearables have a very big role. But what is the role of the smartphone in the delivery of health? How do we need to think about this? And we know that the smartphone today is doing a lot more than just making phone calls. Whether you're sending emails, accessing information online, using your camera for pictures, or using the microphone for sounds. So we're unlocking a whole plethora of different use cases to improve user agency. And I'm going to give you some examples of how we're thinking about it now, which maybe if we would have thought about a couple of years ago, would have sounded a little bit like science fiction. But first and foremost, I want to guide you here to sort of how we think about this open health stack. So you remember I mentioned it's very difficult to scale solutions today in the digital world. And if you think back to my earlier comment about the role of the community, is allowing and empowering them through an open sourced code platform to be able to build bespoke products and solutions for that community. So in other words, it's opening the opportunity for developers to be able to use the technology on an open sourced, in an open source manner. And then thinking through, well, gosh, well, what other things might you be able to do with a phone? And sort of today, you know, this should be animated here on the right, but you see sort of heart rate and respiration is already available through the Android Google Fit app. But if you think about how we're progressing with this going forward, and hopefully in the next couple of years, if we meet again, we'll have an update on this one, is no physician visit. It will not involve use of a stethoscope. So how can we use the telephone's microphone for auscultation? Or how might we know that computers can also hear things that the human ear can't? So a COVID cough is different to a flu cough, and in this case, different to a TB cough. There are marked differences to understand those biomarkers. So how can we use that to enhance screening so that people that would otherwise go unnoticed say, you might have an issue here, go to the doctor and get yourself diagnosed. And then anemia, which is a huge cause of multiple comorbidities associated to it, but also things like malnutrition. If we're thinking about global access to to wider communities, to people that may not necessarily have access to this. Did you know that a phone can also potentially help as an ultrasound device? Now, ultrasound devices are quite important because ultimately they offer a way of being able to listen to the sounds of the body without using radiation. So that sounds like a pretty neat thing, but it's kind of hard to ship ultrasounds everywhere in the world and difficult to use them. So these are things that we're publishing and we're testing now, in this case to see fetal health, to be able to use your mobile phone, to be able to scan. This is connected to a device that will then surface the images on an iPad, which hopefully more and more people are having access to. So really the goal here is thinking, how do you enhance the ability of being able to deliver care where people need it most and meeting people where they are, and hopefully also preventing them from becoming big users of care, but more oriented towards prevention. This one I'm personally very excited about because I was very involved with it in the early days. But it started off being for diabetic retinopathy. Now, diabetic retinopathy is a disease that's relatively, it's easy to diagnose if you're a specialist, but if you're thinking about a wider GP audience, sometimes misdiagnosis can be present. So, the traditional way you do that is you take a scan of the fundus of the eye. You could see the device there on the left. And what started off being an AI algorithm to be able to tell us whether or not a patient had diabetic retinopathy started to open up a whole plethora of different use cases for us because the AI could see things that the human eye could not. So in other words, there's nothing in the literature that will tell you that a female eye scan is different to a male eye scan, yet the AI was able to tell us that with over 90% accuracy. There's nothing in the literature that will tell us what an HbA1c risk score of a patient should be by looking at the fundus of the eye, but the AI was able to tell us that with a very high degree of confidence as well. So how do we scale this? You can't have these machines shipped all over the world. You could ship the AI out, but we wanted to make it more accessible. So what we're exploring now, interestingly enough, taking a picture of your eye externally, which we could do through our smartphones, gives you very similar results. So these are things that we're working on research, and we hope to have publications on these over the next couple of years. So then by taking a picture of the eye, you might be able to tell your blood sugar risk, your cholesterol, or if you're at risk of other diabetic diseases or things like chronic kidney disease. So this is the area that we're focusing on now, is sort of thinking about how we scale this out to a wider audience. This one I'm also very excited about because, a picture's worth 1,000 words. It's very difficult for you to describe in text a skin condition that you might have. Many times we sort of, if you talk to a doctor, you're trying to take a picture or you're trying to describe it, it often involves can you come in, let's have a conversation about this. If you're having, like in my case with my dermatologist. Here what we've done, and this is only available in the US and Japan as well. We just launched it a couple of months ago. But if you use Google Lens to go for shopping, has anybody used Google Lens to sort of search for, bird or butterfly or whatever in the garden? It's doing the same for skin conditions here, and it's able to tell you what that skin condition is likely, what the skin condition is. Now again, these are not diagnostic devices, these are screening devices. So it's telling you what you might potentially have so you could go to the doctor and get yourself checked out so that it gets validated. Because all of these ultimately are just tools to be able to improve consumer agency and knowledge of what they need to do next. So again, available in the US and Japan. All right. Very, very important. So somebody talked about large language models and the advent of, generative AI. So, guys, this is a world that's really going to change over the next few years. You've already noticed it significantly. But we tested out, we trained a specific large language model. Our large language model is called Pathways Language Model. We fine-tuned it using 7 specific data sets, and one of them was medical licensing exam questions. So we call this conveniently MedPalm. And you see the first publication that we had in December of 2022, MedPalm was scoring at about 67%, which was above the approximate pass mark for medical licensing examinations in the US. And in March 2023, this is now scoring at expert level testers. So basically, you have, really the most sophisticated AI sitting in your pocket to be able to answer highly complex medical domain questions, which is allowing really a co-pilot world to help as an enabler to be able to improve the quality of care. And again, this was published in Nature in March of 2023. Now it's exploring multimodal factors. So instead of just using text, can you have conversations with the radiology image, for example, to be able to test whether the diagnosis is correct or even potentially do quality control on that as well. And this one, probably one that we should really call out, April 2023. Somebody said all of this started in November of last year, so 6 months after. You could see here in this, published in the Journal of American Medicine, as rated by patients, generative AI is scoring higher on quality and on empathy in conversations, health-related conversations, right? So in this case, you have the quality ratings there. Patients are evaluating chatbot better than physicians, and on empathy ratings, also higher than HCPs. And part of it is understandable, right? HCPs are extremely busy. They hardly have enough time to come up for air. And if a patient has a chronic condition and wants to talk about it, the AI doesn't get tired. They don't mind, putting in an extra word. Now, I think the very important thing here is that all this, in my opinion, for now at least, needs to be human supervised. We don't want to unleash this in a way that's irresponsible. But you could see that here that, what the potential might be in the future in terms of engagement with the community at large. And I'm sure all of you have used it, but this is certainly going to play a role in the health domain as well. Great, I'm at time, but I just want to share with this final checklist here, if you're thinking about sort of how to get started with health equity, this is not exhaustive and by no means is supposed to be really the one-all be-all, but just sort of some questions to get started, saying like, customers, how do you get started on health equity? These are just a few points here to guide you through it. Thank you very much.
Thank you very much. Please stay on the stage, Andrew, for just a quick question. Thank you so much. You mentioned that technology should be the great equalizer, that's the way, but you also pointed to threats and risks attached, because it sounds like a bittersweet symphony in the sense we see lots of potential threats and lots of potential opportunities. So one quick question, Andrew. In the next 5 years or so, do you think that the threat ratio will increase significantly more than the opportunity ratio, or vice versa?
The reason why we're seeing the uptake is because clearly people see the benefit of it. So there's certainly a need out there that's going to require this. And I think that benefit will continue to far exceed the risk. However, we need to be very cautious as we think about this. So, we haven't had time really to get into today, but picking which model you're using, testing it, understanding what data you're using to fine-tune your model before you release it, and always having human in the loop is very, very important as we think about this. It's about society gaining experience, learning from this, having regulators involved in the conversation as well, I think is critically important. But I think the benefits will continue to outweigh the risks. But as always, we need to watch this like a hawk.
And with this optimistic message, we'll proceed to the first panel. Andrew Miles, thank you again.
Thank you.